How do doctors diagnose cephalalgia? Have you ever wondered how doctors figure out what type of headache you have? The process can be quite detailed, especially since there is no single test to confirm a migraine or other types of headaches. Let's break it down step by step. The first thing a doctor will do is gather a thorough medical history. They will ask you about your headaches, including when they started, how long they last, how often they occur, and where the pain is located. They will also want to know how intense the pain is and what type of pain you experience. In addition to these questions, your doctor will ask about any other symptoms you might have. This can include nausea, vomiting, sensitivity to light, sensitivity to sound, and any visual or sensory changes that happen before the headache starts, known as auras. Family history plays a role too. If someone in your family has a history of migraines, it could indicate a genetic link. Doctors will take this into account when making a diagnosis. Next, a physical and neurological examination is performed. This helps the doctor rule out other causes of headaches that might mimic migraine symptoms. They will check your mental status, motor strength, vision, reflexes, and cranial nerve function. This examination is essential to exclude serious conditions like brain tumors or infections. If your headache symptoms are unusual or severe, your doctor may recommend imaging tests. These could include magnetic resonance imaging or computed tomography scans. These scans help identify any structural issues in the brain that could be causing your headaches. Doctors follow specific clinical criteria for diagnosing migraines. According to the International Classification of Headache Disorders, a diagnosis typically requires at least 5 headache attacks lasting between 4 to 72 hours. The headaches usually have specific features, such as being on one side of the head, having a pulsating quality, and being moderate to severe in intensity. During these headaches, many patients experience nausea or vomiting, or sensitivity to light and sound. Doctors also use a method called differential diagnosis. This helps them distinguish migraines from other types of headaches, like tension type or cluster headaches, by focusing on the unique symptoms and patterns you present. In summary, diagnosing cephalalgia involves a combination of your medical history, symptom patterns, physical and neurological exams, and sometimes imaging tests to rule out other causes. This thorough approach helps ensure that you receive the right diagnosis and treatment for your headaches.